and you will be drawing the prana from that way. So actually you will begin to forget to breathe, but you will still be drawing in prana energy. Okay? But this is the beginning stages for those who are just starting out. So here, in Qigong, we call it the hugging the tree technique. You can do it this way, or either actually stand like this. This is what's called hugging the tree technique. You can see that my hips are slightly pushed forward, tilted forward, knees slightly bent, head downwards, hands about at the portion of the heart arch in a circle. You can do it here at the third eye, at the heart, and at the navel. Those are the three energy treasures. This is where we store this energy at. All right? The chi, the jin, the shin. That's what it's called. The chi is stored here. It's transmuted to love. All right? Which is the jin, G-I, N-G. Then it's transferred to unconditional love, which is spiritual love, which is here, the shin, S-H-I-N, S-H-E-N.
Remember had the Soviet Essentials that was called that?
Right. Exactly. They still on the market?
Nah, man. That's that shit. When Pepsi bought them, they killed all that.
Dang. Okay. So, you will thank the tree for the prana. Some of you may experience numbness or tingling sensation throughout the body. Once esoteric principles and techniques are fully explained, they are usually very simple. After energizing yourself, it is vital to circulate the prana through the body. So, only thing you have to do is visualize the energy being stored into one of those locations and then send it in a microcosmic orbit, which we'll get to in a second here, which is up and down the spinal column and then down the front of the body. It's called your conceptual and your governing vessel. Those are your two main meridians that activates the other 12 meridians. Alright, so visualize yourself filled with light or prana, circulating the prana continuously from the back to the front several times, then from the front to the back several times. So sensitizing the hands through pranic breathing. Alright, back in the days what we did, just clap. Do this, or shake your hands. Man, your hands tingling. Well, you're a healer. So, your hands already tingling. So, sensitizing your hands, having to do the breath technique, you know what I'm saying? You can, but it's easier to do it the way that we just did. Alright, most of you should have more or less permanently sensitized your hands, exactly. However, sometimes you may experience moments when the hands seem unable to feel the skin. This can be immediately remedied by concentrating simultaneously on the center of your palms and on the tip of your fingers while doing pranic breathing for about 3 cycles. Alright, this will cause the hand chakras and the finger chakras to be activated, energized, and sensitized so that you can scan accurately with your palms and your fingers. Now, we used to do the scanning techniques, which we'll get to here in a second. We won't go through that because it's the same information that we just read, basically. So, energizing with pranic breathing. We already did that. Alright. This is called double. We go back to that. It's called double energizing. There are 2 types of double energizing and energizing with 2 hands. Parallel double energizing and non-parallel double energizing. In parallel double energizing, simply place your hands facing and parallel to the area, like this. And this also causes the area to increase in heat and healing simultaneously. Alright, hands can be here over the belly or wherever the person is hurting at. You can place both hands over those particular areas. Remember, you have front and back chakras. So, once you do the pranic healing, as you see here, he has a plant with dirt next to it. He'll take off the bioplasmic energy that's negative, because oftentimes we have, based on our thoughts and thoughts from the environment, becomes crystallized around our auric field, in which that causes leaks and holes in our auric field and causes illness and sickness and disease. So what happens is that when a pranic healer comes in your area, what they'll do is strip you of this debris, and they'll cast it off into a plant or dirt or water, in which that can be cast out later on. All right. So this is disposing diseased bioplasmic matter. There are times when it is inconvenient and not possible to throw the diseased bioplasmic matter into a bioplasmic waste disposal unit. Should this happen, just simply visualize a fire beside you and throw the diseased bioplasmic matter into the fire. Then extinguish the visualized fire after treating your patient. You will also use the you can also will the diseased bioplasmic matter to disintegrate when you flick it away. All right. So these two techniques are to be used only by more advanced healers. All right. For beginners, you can try to heal in open spaces and throw the diseased bioplasmic matter into the ground. It is a common practice among shamans to dispose of objects filled with the diseased bioplasmic matter by burning them, exposing them to the air for long periods of times, or burying them underground. Okay? Now, this is the practice schedule. Following this schedule below for about 2 weeks. You should also try to treat many difficult cases. If you follow the instructions in this book consistently, your healing skills will develop very rapidly. You will be able to do a lot of things that may be considered by others impossible or miraculous. All right? Scan with your 2 fingers for 5 minutes. Pranic breathing and drawing in air prana through your hand chakras for 5 minutes. General sweeping at a distance of 3 feet from the patient for 5 minutes, and then energizing your pranic breathing for 5 minutes. All right? Now, this is Anulo violon pranayama, or pranayama. This is basically the alternating nostril breath technique. Procedure here is to hold your right nostril with your thumb, breathe in from your left. Now out your right nostrils and close your left nostril with your middle and ring finger, and breathe out from your right nostril. Now breathe in from your right nostril. Now close your right nostril and open your left and breathe out in the left from the left nostrils, and so on. Duration at least 10 minutes. We won't do the whole 10 minutes, but look what it does. It benefits. Helpful for what? Heart, high blood pressure, heart blockage, vertigo, which is actually your stomach area being tied up, arthritis, cartilage, bent ligaments, sinus fluid reduction, Parkinson's disease, paralysis, neuro-related depression, migraine pain, asthma, sinus, allergies. So this is what we get ready to practice right now. All right, it's the alternating breath technique. And basically what it's talking about is breathing in, closing your left nostril, your right nostril. Breathe in through your left, hold it, then breathe out through your right, and then reverse the process. All right, we're gonna do this 10 times, not for 10 minutes, just 10 times. Okay, so we're gonna do the 6-3-6-3 breath technique here. So we're gonna breathe in for count of 6, hold it for 3, go to the other side for 6, hold it for, you see what I'm saying? That's how we're gonna balance this out. So we begin, close the right nostril, breathe in for 6,